5 warning signs of kidney failure tests you must do. Did you know that over 850 million people worldwide suffer from kidney disease, and most don't even know it until it's too late? Kidney failure doesn't scream, it whispers. And by the time you notice, the damage is often permanent. But today, you'll learn how to catch it early. We're diving into the 5 warning signs of kidney failure and the critical tests you must take before it's too late. So if you're over 40, if you're diabetic, or if you've ever had high blood pressure, stop scrolling, grab a notebook, and let's dive in. And if you care about your health and your loved ones, make sure to hit that like, subscribe, and share this video with everyone you care about. Let's save lives, together. Warning sign number 1. Changes in urine. Let's talk about something most people ignore, until it's too late. Your urine. Yes, it may sound awkward, but it's actually one of the most powerful indicators of your kidney health. Think of your kidneys as high-powered natural filters. They work 24/7, removing waste and extra fluid from your blood. That waste, it leaves your body through urine. So if your urine starts acting weird, your kidneys may be in danger. Let's break it down. 1. Color changes. What is your urine telling you? Healthy urine is usually pale yellow and clear, like lemonade. But if your urine looks like dark yellow or orange, you may be dehydrated or your kidneys may be struggling to process waste. Brown or cola colored. This could mean there's blood or muscle protein breakdown, often linked to advanced kidney disease. Foamy or bubbly urine. This may indicate protein leakage, a serious sign that your kidney's filtering system is damaged. If your pee starts to look more like root beer than lemonade, it's time to take action. 2. Frequency. Are you peeing more, or less? Both can be signs of kidney issues. Going too often, especially at night. That might mean your kidneys are losing their ability to concentrate urine. Barely peeing at all. That could be a late-stage warning, your kidneys are shutting down. Remember, a healthy adult urinates about 6 to 8 times a day. If you're going more than 10 or fewer than 3, and it's sudden, get checked. 3. Pain or burning during urination. This could be a sign of a urinary tract infection, but if it becomes chronic, it might indicate kidney damage or stones. Pay close attention if you experience painful urination, pressure or discomfort in your lower back, cloudy or foul-smelling urine. While not always kidney failure, recurring symptoms should never be ignored. 4. Blood in urine, hematuria. Seeing blood in your urine, or urine that's pink or reddish, can be terrifying. Sometimes it's harmless, but it can also mean kidney infection, kidney stones, or even early signs of kidney cancer. If you see any red, don't wait. Call your doctor immediately. Coming up next, another silent sign of kidney trouble that shows up in your legs and feet. But before we continue, if this information was helpful, don't forget to tap that like button and share it with your friends and family. Your share might literally save someone's life. Warning sign number 2: swelling in feet, ankles, or hands. You wake up one day, and your shoes don't fit. Your socks leave deep marks. Your rings feel tight. What's going on? It might seem like a minor annoyance. But swelling, especially in the feet, ankles, hands, and even the face, can be an early sign of kidney failure. Let's break this down. Why do you swell? Edema explained simply. Your kidneys aren't just waste removers, they're also fluid balancers. They make sure you don't retain too much sodium. You don't hold onto excess fluid. And your blood pressure stays stable. But when kidneys start to fail, they can't filter properly. So what happens? Fluid builds up. Sodium gets trapped in the body. And gravity pulls that extra fluid down to your lower limbs. This is called edema, and it's not something to ignore. How to spot dangerous swelling? Ask yourself, are my feet or ankles swelling by the end of the day? Are my hands puffy in the morning? Do my socks or shoes feel tighter than normal? Try the finger test. Gently press your thumb into your ankle for 5 seconds. If a dent remains, that's called pitting edema, and it could be a sign of kidney problems. Also pay attention to symmetry. Swelling in both feet or both hands equals kidney or heart issue. Swelling in just one limb. Might be a vein or injury issue, still worth checking. Other symptoms that often come with swelling. Shortness of breath, fluid can build up in the lungs. Weight gain without eating more. Tiredness and brain fog. Less urination or darker urine. All of these point back to one core issue: your kidneys may not be keeping up. What you can do right now. 1. Track your swelling daily. 2. Reduce salt. 3. Elevate your legs. 4. Hydrate, but smartly. The critical tests you need. If you're dealing with frequent swelling, it's time for lab work. Don't ignore the signs. Don't delay testing. Because early detection equals early protection. Coming up in the next section. Why feeling constantly tired, foggy, or out of breath might not be aging, but toxic buildup from kidney decline. Warning sign number 3: fatigue and brain fog. You're exhausted. You sleep 8 hours, but you wake up feeling like you haven't rested at all. Your head feels foggy. You can't concentrate. It's like your mind is swimming in quicksand. What's going on? Fatigue and brain fog are common symptoms that many people ignore, chalking them up to stress, age, or simply being overworked. But here's the truth: they can also be signs of kidney failure. Your kidneys are responsible for filtering out waste and toxins from your blood. When they aren't working properly, these toxins start to build up in your system, causing a toxic overload. That's when the fatigue sets in. That's when you feel cloudy and sluggish. 1. Why does kidney failure cause fatigue? Think of your kidneys as a garbage disposal for your blood. They remove waste like urea, creatinine, and excess fluid. But when your kidneys start to fail, these waste products accumulate. This buildup doesn't just stay in your blood, it spreads throughout your entire body. As toxins build up, your organs and muscles are deprived of the oxygen and nutrients they need to function properly. This leads to constant tiredness, lack of energy, and difficulty performing normal daily activities. 2. Brain fog. It's more than just forgetfulness. Brain fog doesn't just make you forget where you put your keys or how many cups of coffee you've had. It's that sluggish feeling when you try to concentrate, but your mind just isn't cooperating. The medical term for this is uremic encephalopathy. It happens when urea, a toxic waste that your kidneys would normally filter out, builds up in your blood, affecting your brain's ability to function. It's why you might feel confused, disoriented, struggling to think clearly, or even a bit spacey during simple conversations or tasks. 3. Why you're always tired, even after a full night's sleep. When your kidneys aren't working properly, they can't remove the waste products from your blood. This leads to a buildup of toxins, making you feel chronically fatigued, no matter how much sleep you get. Here's why. Urea and creatinine build up in your bloodstream, making it harder for your body to get rid of waste, which drains your energy levels. When the kidneys fail, fluid balance is off, causing dehydration or overhydration, both of which make you feel sluggish and weak. 4. The connection between anemia and kidney failure. Another common reason for fatigue in people with kidney disease is anemia. The kidneys produce a hormone called erythropoietin, EPO, which tells your bone marrow to produce red blood cells. When kidneys are damaged, they produce less EPO, leading to a drop in red blood cells, which carry oxygen throughout your body. This can cause iron deficiency anemia, which leaves you feeling weak, tired, short of breath, pale. 5. What you can do if you're feeling tired and foggy. 1. Track your energy levels. 2. Hydrate properly. 3. Ask for blood tests. 4. Get active. Final thoughts on fatigue and kidney health. Fatigue and brain fog are silent symptoms that too many people dismiss as part of everyday life. But remember, they could be a warning sign of something much more serious: failing kidneys. If you're experiencing persistent tiredness, confusion, or brain fog, don't just chalk it up to a busy lifestyle or poor sleep. Get tested. Early detection is key to slowing down kidney disease and protecting your overall health. Coming up next, we'll discuss another warning sign: how shortness of breath might indicate your kidneys are in danger. Warning sign number 4: shortness of breath. You used to climb stairs with ease. Now, even walking across the room makes you breathless. You feel tightness in your chest. You gasp for air while lying down. Sound familiar? You might assume it's asthma. Or just getting older. But it could be something more dangerous, a warning that your kidneys are failing. Let's unpack why shortness of breath, also called dyspnea, is a serious signal your kidneys might be struggling. 1. Fluid overload. When your lungs fill up, your kidneys help control the amount of fluid in your body. When they're not working properly, fluid builds up, not just in your legs or hands, but also in your lungs. This condition is called pulmonary edema, and it makes every breath feel like a struggle. You may experience trouble breathing when lying flat, nighttime coughing or gasping, a feeling of drowning or heaviness in your chest. 2. Anemia and oxygen deficiency. Another major reason for shortness of breath in kidney failure is anemia, a lack of red blood cells. As we explained earlier, damaged kidneys stop producing enough erythropoietin, EPO, the hormone that triggers red blood cell production. Fewer red blood cells equals less oxygen getting to your muscles, brain, and lungs. So even light activity can leave you exhausted, dizzy, breathless. 3. Acid buildup in the blood, metabolic acidosis. When your kidneys fail, they can't get rid of acidic waste products. This causes a condition called metabolic acidosis, where the blood becomes too acidic. In response, your body tries to compensate by increasing your breathing rate, trying to blow off carbon dioxide to rebalance pH. This can make you breathe faster than normal, feel like you can't get enough air, experience chest discomfort. 4. When it's more than lungs. Sometimes, people are misdiagnosed with asthma or heart failure, when the root cause is their kidneys. Here's how to tell if your shortness of breath might be kidney related. Do you also have swelling in your legs, ankles, or face? Are you urinating less than usual? Do you feel more tired and foggy than normal? Have you gained weight quickly over a few days? If you said yes to 2 or more, it's time to talk to your doctor about your kidneys. 5. What to do right now. 1. Elevate your upper body at night. If you're breathless while lying down, try sleeping on an incline or using extra pillows. 2. Monitor your breathing. Notice if your breathlessness worsens during rest, activity, or lying down, and if it's paired with swelling or fatigue. 3. Get these tests done ASAP. Chest X-ray or CT scan to check for fluid in the lungs. GFR and creatinine kidney function. CBC panel to check for anemia. BNP test to rule out heart failure. Your doctor can piece these clues together and may catch kidney failure early. Final message: don't ignore the breath. Shortness of breath isn't just about lungs. It's a red flag, and often, your kidneys are to blame. Pulmonary fluid, anemia, acidosis. These are silent symptoms building up behind the scenes. So if you've been gasping for air more often, don't delay. Get tested. Speak up. Act early. And in our next section, we'll cover the number 1 sign that shows up in your urine, the most direct clue your kidneys are under attack. Warning sign number 5. Changes in urine appearance or frequency. You might not think twice about your urine, but did you know it's one of the first places kidney problems show up? Your urine is like a mirror to your kidney health. If your kidneys are starting to fail, they often send distress signals through your urine, signals you can see, smell, and feel. So let's break it down. What kinds of changes in your urine should make you worried? 1. Urine color, what it's telling you. Foamy or bubbly urine. This is a major red flag. It means there's protein in your urine, a condition called proteinuria. Healthy kidneys prevent protein from leaking out, but when they're damaged, they can't hold it back. Dark brown or tea-colored urine. This could indicate blood or waste buildup in the urine, both signs that your kidneys aren't filtering properly. Red or pink urine. This could be hematuria, blood in your urine. It may look scary, but even small traces of blood can mean kidney infection, stones, or advanced kidney damage. Cloudy or murky urine. This might signal a urinary tract infection, UTI, or an imbalance caused by kidney dysfunction. 2. Urine frequency, too often or not enough. Your kidneys control how much urine your body produces. So if you notice Frequent urination, especially at night, nocturia. Sudden urge to urinate but little comes out. Or long gaps where you hardly urinate at all. It could be your kidneys failing to regulate properly. Too much urination may mean your kidneys can't concentrate your urine anymore. Too little urination could be a sign of advanced failure, where kidneys are barely filtering blood. 3. Changes in pressure or pain when urinating. If you're experiencing pain, burning, or pressure, this might point to a blockage, kidney infection, or stones. All of these could affect your kidney function long-term if untreated. Don't ignore these signs, especially if they come with back pain, fever, chills, or foul-smelling urine. 4. Protein in urine, the silent leak. One of the earliest signs of kidney failure is protein leakage into urine, and it's not always visible. That's why doctors often run a urine albumin to creatinine ratio (ACR) test. If your body is leaking albumin, a key blood protein, it means your kidneys' filtering units are damaged. Left unchecked, this leak leads to fluid retention, swelling in legs and ankles, high blood pressure, and faster kidney damage. 5. What to do if you notice changes. If you see any unusual urine changes, don't wait. Here's what you should do. 1. Get a urinalysis test. 2. Ask for a kidney function panel. 3. Track your symptoms. 4. Stay hydrated, but wisely. Final thoughts. Don't flush the warning signs. Changes in your urine are not just random quirks, they're warnings from your kidneys. Your body is speaking to you every time you go to the bathroom. Foam, blood, dark colors, unusual frequency. These signs should never be ignored. And that wraps up our 5 critical warning signs of kidney failure, but we're not done yet. Up next, we'll break down the must-do tests that everyone should request from their doctor to catch kidney disease early, before it's too late. Kidney tests you must do to catch it early. Silent, sneaky, deadly. That's kidney disease. It often doesn't scream, it whispers. By the time obvious symptoms appear, up to 90% of kidney function may already be lost. That's why testing early is not just smart, it could be life-saving. Here are the top 5 medical tests you must ask your doctor about if you have high blood pressure, diabetes, a family history of kidney problems, or any of the symptoms we discussed earlier. Bonus. Who should be tested annually? You should get tested yearly if you have diabetes or prediabetes, have high blood pressure, take NSAIDs or long-term medications, are over age 60, have a parent or sibling with kidney disease. Final message: knowledge is power. Action saves lives. Let's face it, kidney failure doesn't knock on the door. It breaks in silently. But you now know the signs, and the tests. Early action means preventing dialysis, avoiding transplants, protecting your heart, brain, and life. So get tested. Be proactive. Don't wait for symptoms to get worse. And remember, like this video if it helped you. Subscribe for more health-saving information. And share it with someone you care about. Because the best gift you can give someone is the power to protect their health.